I'm Gemma Crowsdale and I'll be telling you about the Specialist Selective Mutism team. This means we support children with selective mutism and their families. We can also offer support to children who have low confidence in communicating but don't have that formal diagnosis of selective mutism. So we're a small team of speech and language therapists that work across Hayward, Middleton and Rochdale. Between us, we've got quite a few years of experience and we're really proud of what we do. It's our job to provide a speech and language therapy service to children who find it hard to speak in certain situations. This might be called selective mutism, if that's a formal diagnosis that you've been given. Selective mutism is an anxiety condition. That means it's a fear or phobia of speaking in certain situations or to certain people. Often that is in school or outside the home. However, the child usually will speak freely and easily at home at a correct level for their age. Selective mutism, despite how it actually sounds, is not a choice. For people with selective mutism, the anxiety that they experience actually freezes the vocal cords, making it virtually impossible for them to speak in some situations, despite them actually wanting to. Selective mutism can occur alongside other conditions such as autism, language difficulties and general anxiety. It does overlap with these conditions as well, which makes it tricky for us to diagnose at times to work out which is the condition that's causing them the difficulty. If selective mutism is not supported well, especially early on when those symptoms first appear, can lead to long-term anxiety difficulties, and this can impact on education and relationships. So we're here to help. The services that we provide for children with selective mutism depends on a few things. So firstly, we'll look at the types of speech, language and communication skills and needs that your individual child has. And then we pick the right type of support and interventions to help each child. Our role in supporting children with selective mutism is very advisory, simply because children with this condition are likely to find it really difficult speaking to us as we're a new person to them. We're not going to feature regularly in that child's life, so we don't need to increase their anxiety by speaking to a new person. So we train yourself as parents, school staff, any adults around the child in how to support that child in the very best way. We offer things like assessment, advice workshops, drop-in sessions for parents and teachers and education staff. We train you guys in one-to-one therapy approaches for you to become the therapist for your child, and we also provide lots of education around selective mutism and anxiety so that you and your child can understand the condition a little bit more. If we feel that your child requires support in other areas of speech and language development, we can refer them for further assessment and therapy around that as well within our wider speech and language team. Thank you.